Good day. Welcome to this tobacco cessation webinar, where we are going to help you help your patients help themselves by quitting tobacco. Which of your patients are we referring to? Those who use tobacco, smokers, vapors, dippers, or chewers, or dual users. So how do we intend to help you help your patients? By arming you with more knowledge about tobacco and nicotine products and the skills to aid in tobacco cessation. We will work to increase your knowledge base by giving you many facts about several forms of tobacco that are commonly used in West Virginia today. Specifically, we will focus on e-cigarettes and smokeless tobacco products. We will increase your skills by showing you how to hold discussions with your patients. Brief interventions with your patients. The webinar process. At this point, you should have completed the pre-test. You will now watch 4 chapters in the webinar process. After you watch the 4 chapters, you will complete a post-test of which you must score at least 80%. Upon successful completion of the post-test, you will be awarded 1 hour of CEU credit. Your webinar presenters today, myself, Donald Reed. I'm a 4-H Youth Development Extension Agent with West Virginia University Extension Service. Kathy Danbury, she's the Tobacco Cessation Program Manager with the West Virginia Division of Tobacco Prevention. And Dr. Peggy Lambert-Fink, Associate Professor in the Nursing Department at the West Virginia Institute of Technology. This webinar is facilitated by West Virginia University Extension Service and West Virginia University's Institute of Technology. This webinar is funded by the West Virginia Division of Tobacco Prevention, part of the West Virginia Department of Health and Human Resources and the Bureau for Public Health. Our first speaker is Ms. Kathy Danbury, Tobacco Cessation Program Manager with the West Virginia Division of Tobacco Prevention. Kathy, welcome.
Thank you, Donald. I want to talk a little bit about lowering tobacco use in West Virginia. This slide shows some of the demographics about West Virginia. The 2010 census showed that we have 1.85 million people who live in West Virginia. 51% are in rural areas. The adult smoking rate is 25.7%, and the male smokeless tobacco use rate is 18.2%. This infographic from the Center for Disease Control shows known chronic diseases caused by tobacco use. The red text indicates recent findings from the Surgeon General's report. West Virginia's highest smoking rate is among 25 to 34-year-olds with a 36.3% prevalence rate. West Virginia is the highest in the nation for women who smoke during pregnancy. At 27.9%, West Virginia's rate is nearly 3 times the national average, which is highest in the nation. Smokeless tobacco use is highest in West Virginia men 35 to 44 years old, with a prevalence of 27%. West Virginia youth cigarette smoking has declined in the last 15 years, from 38% in 2000 to 16.2% in 2015. We attribute this great success to our youth empowerment program known as RAISE. However, 1 in 5 West Virginia adults have now tried e-cigarettes, which is 20.6% of West Virginia population. 2.6% of West Virginia adults are dual tobacco users, which Donald explained earlier as consuming both cigarettes and smokeless tobacco on a regular basis. An average of 3,800 West Virginia adults aged 35 and older die each year from diseases related to cigarette smoking. Each West Virginia smoker who dies prematurely loses an average of 14.6 years of his or her life. Each West Virginia smoking-related death equals an average of $283,000 in lost wages. Tobacco also has a negative economic impact on smokers and communities. There are 180 million packs of cigarettes sold each year in West Virginia. And tobacco use costs the state of West Virginia $4,676 each year per smoker. That's direct health care cost as a result of tobacco use and the associated lost productivity. Helping patients quit tobacco is a clinician's responsibility. Remember, most tobacco users don't plan to fail. They fail to plan. Healthcare providers have an ethical obligation to help their patients plan to succeed instead of fail. You should be comfortable counseling a tobacco user to quit and counsel for success. So, as a healthcare professional, what exactly can you do? There are 3 important things. Be aware that it takes, on average, 4 to 10 quit attempts for a long-term success. Use pharmacotherapy to increase success. Change your office system. Ask every visit about tobacco use. Have educational handouts available. Refer to the quit line. Use facts to quit forms. This and other resources can be found on the West Virginia Division of Tobacco Prevention website. How you can help. As healthcare providers, you are seen as health leaders in your communities and the state. Encourage and support your patients to quit tobacco use. Become an advocate for good tobacco policy in your work sites, communities, and the state. In conclusion, smoking risks are more deadly than they were 50 years ago. Smokers inhale over 7,000 chemical compounds. At least 70 of those compounds cause cancer. There is no safe level of tobacco use. Thank you.